Not every thought in the mind belongs to yourself. Some are echoes of parents, teachers, culture, or even past pain. Those voices that sound internal but aren't truly yours. Welcome to my channel. I'm Dr. Jessica Ratman. I'm a GP. My aim is to help you have a more holistic approach to life with a particular focus on self-improvement. If you like this video, be sure to share and be sure to subscribe. The inner critique, the doubts, even the encouragement we hear inside aren't always original. They're often borrowed. Over time, the brain records the voices of authority figures, peers, and experiences, then plays them back as if they were our own. This matters because when those voices go unexamined, they shape identity and choices without our consent. A person might think they're being cautious when in reality they're replaying a parent's warning, or they might chase success not because it's their desire, but because society's voice equated worth with achievement. So the real challenge here is learning to distinguish these voices. Is this my voice or someone else's? I still remember when I came back after spending a few years in Nigeria, and I was sort of looking at what direction to take in terms of my career at that point. And I remember saying to my dad, well, I never explored different specialties. I think at that point I'd done rotations in cardiology, internal medicine, elderly care. And as much as I loved the aspect of becoming a med reg, and I really loved the clinical aspect of it in terms of the skills, and I really probably deep down had wanted to do something like ACS, sort of acute medicine with that sort of anesthesiology component to it. I did know for me that starting a family, getting settled was so much more important than necessarily having that aspect of a high demanding career in terms of being a doctor. So I sort of looked at everything and I sort of came to the conclusion that the specialty that would sort of allow me to explore my other interests in terms of integrative medicine, alternative medicine, internal medicine, still allow me to feel that I was being a diagnostician, allow me to have that balance, life work balance that I was really looking for in terms of planning towards my future. And I came down to family medicine. I remember saying this to my dad, and my dad was like, nobody does GP. Like, the community is going to think that you're not intelligent. You need a proper specialty, he said. And I was like, Dad, general practice is a proper specialty. Family medicine is a recognized specialty. In fact, it's one of the hardest because GPs have to know a lot of knowledge. They have to be able to assess a patient in such a short space of time. They deal with so many things. And my dad wasn't convinced. He was like, oh, but Jessica, you're so much more than that, he would say. You should do internal medicine, cardiology. I mean, I know you couldn't do surgery. He said, because of the fact that you just can't maintain your blood pressure. I faint easily when I stand for long periods of time, but maybe you should look at something within the hospital. And I said, you know what, Dad, I've done the assessment. I've looked at my personality within the profession in terms of things that would suit me, what I want for my future. And I've really come down to two things. I've come down to family medicine or psychiatry. And I decided that actually within family medicine, I would still be able to explore my interest in mental health. I would still be able to do integrative medicine. I would still, if I wanted to, go and have a component of interest in elderly medicine, any of those areas that I if I'd wanted to explore. My parents weren't convinced, but I realized in that moment that I needed to listen to my voice. I knew myself better than anybody else. I knew what I was trying to achieve moving forward. I knew for me, having my family, being married was here and then career. So I knew I needed to do something that, yes, I wouldn't feel like I wasn't still exploring fully that career components, the academic side, the physician side of things, but it wouldn't hinder me in my personal life, which was more important to me. And so I knew at that point I had to agree to disagree with my parents. I was like, I'm not going to listen to the fact that maybe the Nigerian community thinks being a GP is the easy route, because I know why I'm doing it. I know that this suits my personality. I know that I will find the most amount of fulfillment. I know I don't want to do another night shift or weekends if I don't want to. And these things matter to me more than what the community thought or whether my parents felt that I was, in their words, wasting my brain doing it. And honestly, it has been the best decision I made. I love being a GP. And guess what? Everybody now wants to be a GP. How interesting, right? The community now wants all their kids who are doctors to be a GP. It felt really important to me in that moment to differentiate what parents wanted, others may have wanted from what I knew I wanted. And I went full heartedly into becoming a GP, and I have absolutely no regrets. So, how do we identify whose voice is in the mind? Well, let's break it down. Number one, notice the tone. Pay attention to how the thought speaks inside your head, not just what it says. Authentic inner guidance is calm, steady, and matter of fact. It doesn't rush, threaten, or shame. It may be direct, but it's never cruel. Whereas borrowed voices, on the other hand, often sound like echoes of authority. They carry harshness, pressure, or judgment. Sometimes they use absolute words like always, never, or should, especially note shaming messages. Those usually come from someone else's expectation that got lodged in your mind. Number two, trace the origin. When a thought arises, stop and ask, where have I heard this before? Often the answer is clear. It might sound exactly like a parent's criticism, a teacher's rule, a boss's demand, or even a cultural script about how you're supposed to live. If the language or tone feels familiar, it's probably a borrowed voice. True inner guidance rarely repeats someone else's word for word. It comes fresh in your own language at the pace of your own life. Number three, check the alignment. Hold the thought up against your current values, goals, and desires. Does it support the kind of life you actually want now, or does it push you towards something that doesn't fit anymore? Authentic voice feels like it belongs to you today. It creates a sense of flow, even if the message is challenging, whereas borrowed voices usually feel heavy, guilt-laden, or disconnected. They tell you to obey rather than to grow. If a thought doesn't match your own sense of direction, it's probably not yours. Number four, test with action. The clearest test is to put the thought into practice in a small way. Don't commit your whole life to it, just try a step. If the action gives you energy, clarity, or a sense of relief, you're probably acting from your authentic self. If the action leaves you feeling drained, resentful, or resistant, then the thought likely comes from an outside influence. Real guidance sustains you. Voices tend to wear you out. Over time, the test makes it easier to separate what's truly yours from what's been planted in you by others. The mind is full of echoes, but not every echo deserves obedience. By noticing tone, tracing origins, checking alignment, and testing with action, it becomes possible to separate the authentic self from the borrowed voices. And here's the connection. Once those voices are identified, the next step is learning how to replace them with trust in the self. That's where the next series ties together, because the struggle to trust yourself often begins with listening to the wrong voice.